Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this video. On this video, we're continuing with our ongoing series entitled The QME's Championship Playbook. And if you're just joining us, we just completed session 1 of this program, wherein we talked about how the qualified medical evaluator ramps up his preparation in the 2 weeks preceding the date of an upcoming evaluation. And the very best qualified medical evaluators are meticulous in their preparation for an upcoming evaluation. In our last session, we talked about how the cover letters, how the medical records, and how any diagnostic studies that have been obtained to date are the critical information upon which the qualified medical evaluator relies in his preparation for an upcoming evaluation. It's through the use of cover letters from the claims administrator, from the applicant attorney, and the defense attorney, and the associated medical records and any associated diagnostic studies that the qualified medical evaluator relies upon to determine the scope of the upcoming evaluation. And in addition to the scope of the upcoming evaluation, this information contained in the cover letters and in the medical records and in the diagnostic studies is critical for a determination of the complexity level. In other words, which of the medical legal fee schedule codes, the ML codes, you'll be using for billing purposes for your evaluation. So the complexity level of the evaluation is determined from the cover letters and the medical records. And the very best qualified medical evaluators are like a dog on a bone, a dog on a bone, in the 2 weeks preceding an upcoming evaluation in ensuring that indeed by the time of the evaluation they have the cover letters, they have the medical records, they have copies or soon will receive copies of any of the diagnostic studies that have been completed so far in the case, because these materials are critical in pulling off a fabulous evaluation that goes exactly along a predetermined path, and that path is determined exclusively by the qualified medical evaluator. So the qualified medical evaluator begins to establish and exert control over the case at approximately 2 weeks prior to an upcoming evaluation. Now, in today's session, what I want to talk to you about has to do with how the qualified medical evaluator can prepare the file and can prepare the report in such a way that by the time the qualified medical evaluator actually gets to the face-to-face evaluation, the report is approximately 85% already completed. All that's needed at that point in time is for the qualified medical evaluator to obtain necessary physical examination, measurements, angles, and findings, and also to order any outstanding diagnostic studies that may be necessary. After that, the report can be very quickly completed and very quickly gotten into the mailbox and out to the parties, and the report can get paid in a timely fashion. Imagine that. So I want to establish a little bit of a goal for us before we get into today's materials, and that new goal is to reverse the common trend that qualified medical evaluators follow, and that is to go into the QME evaluation with an attitude of, hey, let's see what happens here, and then after the evaluation, fully taking the entirety of the 30-day grace period that the law allows us to submit our report, after which we usually get paid at some point in time, hopefully within 60 days, but that, of course, as we know, can vary. The new goal I want to set for ourselves is to reverse that trend so that we go into the qualified medical evaluation completely prepared, perfectly prepared, meticulously prepared, fluently prepared with all the details of the case, such that the report is almost complete by the time we get there. After the face-to-face evaluation, we can very quickly complete the report, get the report in the mail, And the new goal I want to establish for us is to have our reports out and paid, key point, and paid within the 30-day timeline that most doctors use simply to just get their reports out. I believe that if you follow this procedure exactly as the very best evaluators do, you can have your report out and paid for within the 30-day time frame that the law allows us to get our report out. So you can compress time and thereby increase the profitability of your QME practice by getting your reports done quick, accurate, and final. And I have some fabulous ideas that I want to share with you today. So I'm going to go ahead and assemble some notes and look forward to being back with you here in just a few minutes as we continue our discussion today, which is the preparation secrets of the very best qualified medical evaluators. So look forward to being back with you here in just a few moments. Okay, I'm back with you now, and what I'd like to review with you now is some of the things that you can do in the 2 weeks leading up to an upcoming QME evaluation, so that by the time you get to the evaluation, your report is almost completely done. You just need to fill in a couple unanswered questions in the history, maybe fill in some examination findings, complete some diagnostic study findings, and the report is basically done. In other words, you should have a good sense as to what your opinions and conclusions will be, even going into the face-to-face evaluation. And that foresight, that foreknowledge, comes from the preparation that you do in the 2 weeks leading up to the evaluation. So let me share with you some concrete action steps that you can employ for your very next evaluation. After you've done all the necessary work to make sure that you have the cover letters, that you have the medical records, and that you have any necessary diagnostic studies, you then assemble all that information in one place and you take it to your computer where you begin to work on your template, your QME template. Now, everybody should have a template. They should have a male template and a female template that are basically identical from start to finish, and that include all of the major headings and subheadings as required by the 2016 Physician's Guide and also the AMA Guide's 5th edition. So if you don't have an up-to-date current template, you can contact us. We have those templates available for you. We have those in both male and female versions. So some things that you can now begin to do with your template is, of course, you can fill in all of the demographic information related to your examinee, related to the location at which you're going to do your examination, and all of the generic inputting that can be done in the introductory sections of your report can now be done at this point in time. In addition to the demographic information, you can almost completely fill in the history, relevant medical history, and social history sections of your report. Now, with regards to the history and the relevant medical history, I want to make a suggestion that you follow the following format in each of those 2 sections of your report. The history, and then below that is the relevant medical history. Now, here's what I suggest: that you fill in the entirety of the history section prior to meeting the examinee in the face-to-face evaluation. And under the major topic heading of history, you're then going to use a subheading which is simply entitled According to the Medical Records. So in this section, you're going to detail the history as it's relayed to you in the medical records. In addition to that section, the According to the Medical Records section, below that you're going to have a section, a subsection under the history section entitled According to Mrs. Jones. So in the history section, you're going to have two renditions of the history. First is according to the medical records, and then below that is according to Mrs. Jones. And I recommend that you do that in this order because that's typically the order in which we learn about the history. We first learn about the history in the medical records as they come to us in the weeks before the evaluation. And then we compare that medical history in the medical records with what the examinee tells us in the face-to-face evaluation. I much recommend this sequence, in other words, according to the medical records and then according to the patient or examinee, rather than the reverse. And some doctors do the reverse, wherein they first learn the history in the face-to-face evaluation with the examinee, and then later, after the face-to-face evaluation, they review the medical records and then learn about the history from the medical records second rather than first. In my experience, I found that this sequence typically results in a need for a second face-to-face evaluation with the examinee because the testimony as it was given to you by the examinee first frequently has some conflicts in the medical history as the way the history is told in the medical records. So this generally requires a second face-to-face evaluation for you to go back and re-question the examinee about what they said versus what it says in the medical records, and how do we reconcile this discrepancy, whereas when it's done in reverse, it can all be handled in one fell swoop. So the history according to the medical records and the relevant medical history according to the medical records can all be done prior to the face-to-face evaluation. And then you just need to reiterate those steps according to the examinee in both the history and relevant medical history sections. So much of this can be done way in advance prior to even seeing the examinee. The entirety of the review of records can be done prior to the face-to-face evaluation with the examinee, and it should be done. The reason it should be done is because when you review the records, and we're going to talk about how to review the records in an upcoming section, but suffice to say for our purposes now, when you review the medical records in detail, the way that they're supposed to be reviewed according to labor codes and codes of regulation, when you follow procedure as it's established in law, by the time you arrive at the face-to-face evaluation, you are so familiar with the case that you can cite and recite, word for word many times, excerpts from the medical records. And isn't that the way it should be? Shouldn't we show up to the qualified medical evaluation more fluent in the history of the case ourselves than is even the examinee? Okay, makes sense because we have access to the medical records, whereas the examinee has access only to his memory. So we are going to be more fluent in the history of the case than even is the examinee at the time of the face-to-face evaluation. So in addition to the history, the relevant medical history, and the medical records, review of records section of the report, what else can be done in the 2 weeks leading up to an upcoming evaluation? Well, the physical examination section of the report needs to be prepared and needs to be customized for the examinee. So if you're using a QME template, you probably have templated physical examination procedures for every part of the body, as is described in the AMA guides through the various chapters. You have examination procedures for every part of the body. Well, unrelated body parts can now be deleted from your template, leaving in your template only the physical examination procedures related to the accepted body parts. So you can prepare the physical examination pages and customize those pages exactly for your examinee in advance so that you can print out those examination pages and take them with you to the physical examination and simply fill in the findings as you obtain those findings, which can then easily then be re-entered into the template as all of your findings. So the physical examination procedures can be prepared and planned in advance. In addition to the physical examination procedures, the very best qualified medical evaluators begin at this point. They begin thinking about what are the possible impairments that they're going to be examining for. What are the possible impairments that we're going to be examining for? And this brings up a subtle topic which we'll discuss in greater detail in an upcoming session, and that is that when we go to the qualified medical evaluation, our physical examination and the procedures that we employ during our physical examination are chosen specifically for their utility in evaluating for the presence or absence of impairments. We're looking for impairments in the qualified medical evaluation. We're looking to see what impairments is the examinee left with. So our physical examination procedures are tailored to discovering the presence or absence of impairments. And this is different than the way we do our physical examination in our clinical practice. And I'll talk much more about this in an upcoming session. But we want to start thinking at this early point, even before the face-to-face evaluation, what are the possible impairments that this examinee could be left with? If it was a spine injury, what are the impairments? If it was an upper extremity injury, what are the possible impairments? If it was a lower extremity injury, what are the possible impairments that this examinee could be left with? And how do we examine for the presence or absence of those impairments? We want to go into the physical examination knowing exactly which impairments we're going to rule in and which impairments we're going to rule out. Also, the examination instruments need to be assembled in advance of the upcoming appointment. So it's at this point in time that the very best evaluators make sure that they have every necessary examination instrument, that every examination instrument is in their bag, that they know how to use every single examination instrument, that their electronic devices have new and functional batteries, that everything works, and that everything is prepared. That if they need to do a cranial nerve exam, that they have an eye chart, Snellen eye chart, that they have some fragrant material to test cranial nerve number 1, the olfactory nerve, and that they have all the necessary examination instruments to pull off an adequate examination. And we all know the importance under Escobedo of performing an adequate examination. So the prepared qualified medical evaluator is adequately prepared to perform a brilliant examination, the purpose of which establishes the presence or absence of the associated impairments. Okay? At this point in time, in 2 weeks to an upcoming evaluation, the very best qualified medical evaluators already know in advance what diagnostic studies they're going to be ordering. So, for example, if there's a upper extremity injury case, they know that they're going to be taking x-rays to assess for carpal instability, for example. If there's a lower extremity injury, they know that they're going to be ordering lower extremity x-rays to measure cartilage intervals. If there's a spine injury, they know, the very best evaluators know, that one of the impairments of the spine is a loss of motion segment integrity of individual vertebrae. And so they know that they're going to be ordering flexion and extension radiographs. They know this in advance because they know the possible impairments they're going to be evaluating for, and they just simply go ahead and prepare the referral for the diagnostic studies in advance. They notify the examinee of the need for diagnostic studies in advance. Now, the very best evaluators, and let's see if you can count yourself and rank yourself amongst them, the very best evaluators have it so well prepared and so well planned out that they're able to get the diagnostic studies done on the same day as the QME evaluation. Why don't you set that for yourself as a goal for an upcoming evaluation? on your very next evaluation, see if you can get any necessary diagnostic studies done immediately when the examinee leaves your face-to-face evaluation. This could require some preparation, some planning, and some coordinating, but it can be done, and the very best evaluators have it done by game day, by the day of the evaluation. So they prepare the referral in advance. They advise the examinee in advance. What else? What else? They communicate with the imaging center in advance. Now this is an important point. If you've taken the time to order any diagnostic studies for your examinee, you know that obtaining diagnostic studies and getting the studies done properly and the way that you need them to be done can be a challenge. It can be a challenge. And if you don't grab the bull by the horn and take control of every single aspect of the process, guess what? Your studies are not going to come back satisfactory to you. They'll have errors, they'll have poor images, images won't be labeled, central rays won't be positioned where you want them to be, and I'm telling you, if you don't take control of every single aspect of the process, you will be disappointed. So the very best qualified medical evaluators communicate with the imaging center in advance. They communicate with the front desk to confirm that the referral has been accepted and the examinee has a green light to come in. They communicate with the x-ray technician or the imaging technician to make sure that the study that you order is the study that you receive back exactly the way you ordered it. They communicate with the medical radiologist in advance to make sure that the medical radiologist actually reads the order and responds to the order in his report addressing the specific requests that you ask of him. So if you request specific rule-outs, that he addresses each and every one of your rule-outs. If you're looking for specific angles or measurements, that the medical radiologist actually does the angles and measurements. In other words, the very best qualified medical evaluators over-communicate with the imaging center to make sure that the images that they receive are proper. Okay? And all of this can be done prior to the face-to-face evaluation. Then, approaching the evaluation, what are some things that you can do to ensure that all the preparation that you've done up until this point in time is not wasted, is not for naught? Well, it's important to go through several stages and phases of confirmations. So let's talk about some confirmations. Number one is you want to confirm the examinee and their attendance at the appointment 10 days in advance. So you have your staff call up the examinee and confirm, number one, that they've received their paperwork, they've received their appointment notification, and that they're planning to attend. At this point, you remind them to please complete their paperwork in advance of the appointment. You reiterate the directions to the appointment location, and you exchange cell phone numbers with the examinee, giving the examinee the doctor's cell phone number and giving the examinee's cell phone number to the doctor, so that communication can take place on game day if there's any need for such communication. Then, 2 days out from the evaluation, the very best evaluators reconfirm the examinee's attendance. They reconfirm that the examinee has the paperwork completed, or will bring to the evaluation the paperwork completed, okay? And reconfirms the phone numbers and reconfirms the location. Also, if you've asked the examinee to bring to the evaluation any necessary diagnostic studies, it's at this point in time that you would confirm that they have indeed obtained the diagnostic studies and that they are bringing the diagnostic studies to the evaluation. So we confirm the examinee multiple times. Number two is we confirm the interpreter. Again, multiple times. I can't tell you how many times early in my career I showed up to evaluation to have no interpreter. Why did I have no interpreter? Because I left the interpreter to chance. I left the arrival of the interpreter up to the interpreter. And I'm telling you, you need to take control of every single aspect of the evaluation, including the interpreter. So you confirm the interpreter the day before the evaluation. You swap cell phone numbers with the interpreter. You confirm that the interpreter knows the location. You ask the interpreter to show up 15 minutes early, or in the case of an examinee that needs help with paperwork, that they show up 30 minutes early. In other words, the interpreter is a central figure in the evaluation. You do not want to arrive at the evaluation all ready to go with hours of preparation done in advance and not have the interpreter show up. So you must confirm the interpreter. Okay? And then finally, you confirm the location. If the location that you're doing the evaluation at is not your own main office location, then there are other people involved, perhaps in opening the location, in making the location available to you. And I'm telling you, you need to confirm that everybody's expecting you and that space has been cleared for you on such and such a date and such a time for you to complete your evaluation, or else you will be met with surprises. Okay? Confirm examinee, confirm interpreter, and confirm location. And then finally, as you approach the evaluation, you want to make sure that the chart is all set up and laid out in the sequence of activity that you'll be using the chart. The chart should have the necessary physical examination forms. The chart should have necessary disclosure requirement forms under CCR 40. The chart should have all of the appropriate symptom questionnaires that you'll be using on your particular examinee, and the chart should be all laid out and ready to go. It should have examinee sign-in sheet, should have examinee sign-out sheet. It should have your check sheet wherein you check off all the procedures that you need to check off your list before you leave the evaluation. The chart should be laid out and totally ready to go. Okay? So this brings us up to the day of the QME evaluation. You can see that the 2 weeks leading up to this time are a busy time, because this is when the bulk of the evaluation is actually performed. It's actually performed by you in your office with the available medical records, even absent the face-to-face evaluation. It's just the face-to-face evaluation that gives you the remaining details, the remaining facts that you need in order to complete your opinions and conclusions. So we're shifting the preparation of the report to the time period before the evaluation, rather than the way most QME's doctors do it, is to shift it to after the face-to-face evaluation. So finally, in order to complete your preparation for an upcoming evaluation, after all of this heavy lifting and laborious work has been completed, is to begin to focus, you as the doctor, to begin to focus on the key issues of the case. If that's AOE, COE, you start to focus on your investigation of industrial causation through AOE, COE. If it's the diagnosis, you begin to focus on the diagnosis. If it's permanent and stationary, permanent impairment, apportionment, work restrictions, whatever the issues are that are driving the evaluation, this is where you as the doctor want to begin to sharpen your focus and hone your focus and focus your focus on the unresolved issues, so that you can actually resolve the disputed issue and that your report actually brings to a conclusion the unresolved or the disputed matter. So going into the evaluation with your template completely prepared, the medical records completely prepared, your physical examination completely prepared, and some idea as to the potential impairments that you're examining for, along with issues related to impairments such as AOE, COE, and apportionment. And going into the evaluation with these already at the top of your consciousness allows you to very efficiently go through the face-to-face evaluation to obtain every single remaining piece of missing information that you need in order to provide your opinions and conclusions. So, after the face-to-face evaluation, you're simply within a very few days, maybe a week at the most, if you've ordered diagnostic studies, maybe a week at the most, where you can complete your report, get it in the mail, and hopefully get paid even before the 30-day timeline for the submission of your report expires. And this is the goal of the very best qualified medical evaluators. In this way, they can do their reports efficiently, they can do their reports quickly, they can do their reports accurately, and they can do their reports profitably by getting them done, getting them out, and focusing on the very next upcoming evaluation. So doctors, I hope this helps you. In our next session, we're going to talk about two things. One is the review of records and how to properly do the review of records. And then once that's completed, we will then be at the face-to-face evaluation. And I want to begin to talk to you about how the very best evaluators handle the interview and the physical examination procedures in the face-to-face evaluation. And this is going to be a fascinating discussion that I'm sure you won't want to miss. So that's going to do it for today's discussion. I hope this helps you, doctors. Remember that by the time you get to the evaluation, your goal is to have your report 85% complete so that you can get your report out and get it paid within the 30-day timeline for the submission of your report. And that's going to be our new goal on each and every case moving forward. So it's been my pleasure to be with you here today. Look forward to being with you on our very next video, where we continue with our ongoing series entitled the QME's Championship Playbook. So I look forward to being with you again here in just a few moments.